So alpha-gal syndrome is a relatively newly understood condition, which is generically known as a red meat allergy. So there's about 500,000 people in the United States that have this condition, and of course, many more globally. So now, every time we consume this sugar molecule in the form of a meat, or maybe in the form of a medicine which may contain that alpha-gal molecule, or even cosmetics, people will now start reacting to it. So, I hope you cut this piece of my interview out, but if you don't, that's acceptable too. But I'm going to tell you what happened yesterday. And I was having a conversation with a cardiologist friend of mine who told me a story about a patient who was asked.
Welcome to the Kurisko and Company podcast. I'm your host, Dr. Lee Kurisko. Our guest today is Sachin Shah, who's a doctor of pharmacy, and he's a professor at the Thomas J. Long School of Pharmacy at the University of the Pacific. He's also co-founder of Pill Clarity, a national medical information center. He is also regional pharmacy coordinator at Travis Base Air Force and is in charge of research and education there. He has over 50 publications. Joyce and I met Sachin a couple of months ago at a Plant Strong retreat run by Rip Esselstyn. And he was very knowledgeable on a number of topics, and we knew we just had to get him on the podcast. So Sachin, welcome.
Pleasure to be here.
I'm glad. Thanks for doing it. We really appreciate it. So you educated us on a number of issues. The one that probably most pressing is the issue of alpha-gal. And I think most people don't know anything about it. I think I maybe knew 3 sentences about it. So inform us, what is alpha-gal and why is it important?
But beautiful, Lee. Thank you for having me. And yes, thank you for bringing up the topic of alpha-gal syndrome. Now, instead of us talking about alpha-gal syndrome, let me talk to you about the problem and literally what is going on in my cell phone as of an hour ago. Essentially, I'm getting a post, and I'm going to keep this blinded, from a patient that says, I reached out to one of the top pharmacies in the country, and I cannot get the medications that I need. Can you please try? My wife needs her medications right away, and she only has till Wednesday. We have tried multiple places, and we're not able to get it anywhere. We need your help. Please, sir. So this is a text message that I literally got an hour ago, and we are getting such messages from thousands of patients on a monthly basis. And that brings us to the topic of alpha-gal syndrome. So alpha-gal syndrome is a relatively newly understood condition, which is generically known as a red meat allergy. But essentially, it's an allergy to a molecule called galactose alpha-1,3 galactose. And it falls under the umbrella of tick-borne conditions, where this tick, known as commonly the Lone Star tick, but now the CDC says there is 2 other ticks that may be implicated in alpha-gal syndrome. But most commonly, the Lone Star tick bites you, releases something from its saliva into the human body, which the human body now recognizes as foreign. And then it forms an IgE-mediated immune reaction or antibodies to it. So now, every time we consume this sugar molecule in the form of a meat, or maybe in the form of a medicine which may contain that alpha-gal molecule, or even cosmetics, people will now start reacting to it. So there's about 500,000 people in the United States that have this condition, and of course, many more globally. And that's based on CDC data. So when it comes to food, it is often pretty straightforward for you to figure out which foods you may want to avoid. But when it comes to medications, it's a lot harder because 75% of medications can contain animal-derived ingredients such as gelatin, glycerin, and sometimes you can have an ingredient like polysorbate 80, which a general patient would not know where it's coming from, but it's made from acetic acid. Acetic acid has a mammalian component to it. So for medications, it's very hard. And for simple medications like Tylenol and Advil, these people can have an allergic reaction to it. Some data suggest that 50% of these people have had anaphylaxis reaction to common medications that they're taking and ending up in the hospital. And many patients have died as a result of it. And this was first known from this drug biologic called cetuximab, published in the famous journal New England Journal of Medicine. And we found out that cetuximab, made in a CHO cell, Chinese hamster ovary cell line, was displaying this epitope alpha gal, and patients were reacting and having a fatal event. But of course, heparin, as you know, is used in the hospital setting, and some patients react to that as well. So all of this to say, it is a problem. It is underappreciated, it is underdiagnosed, and we need solutions.
Yeah, so my understanding is that I think a lot of animals have this alpha gal in their system, but the difference is primates, including human beings, do not. And so then we're exposed to this foreign substance. We develop the potential to react to it. And I could see one thing being really problematic, as pointed out in your paper to the American College of Cardiology, that the reaction may not occur for 4 to 6 hours later. So you have this anaphylactic reaction, and you have no idea what caused it. And I remember, like, years ago when I was a primary care doctor, that was one of the challenges when people would have like anaphylactic reactions. Well, what the heck caused it? But anyways, your thoughts?
Yeah, spot on. No, that's a great point. Thank you for pointing that out. Because unlike typical allergic or anaphylactic reactions, this is a delayed reaction, anywhere from 2 to 8 hours. So you could have dinner, and many of these patients are waking up in the middle of the night, and they're not connecting the dots. So one number was, the time to diagnosis was about 7 years. Now, fortunately, with recent awareness in the media, that number has come down to a lot shorter. But connecting the diagnosis to what people are eating and the tick bite, the time to diagnosis is pretty long because of this delayed onset type of a reaction. The other thing to point out is, there was a very nice study that pointed out that some patients only have a GI reaction. So it's not the classic hives and allergy, but it's GI symptoms only. So some people may present with just that, and that's something that many GI docs or even primary care need to be aware of, and allergists, of course.
Yeah, no, since I talked to you, I've had a few casual conversations with, other healthcare professionals, and none of them were even aware of this condition. And I think I only became aware of it maybe 2 or 3 years ago. It was sort of mentioned in passing in a book that I read by Dr. Joel Cron. There was only just a few sentences about it. But how widespread now, you mentioned the Lone Star tick, but I understand there's some other ticks that are involved. Like, how is it widespread throughout the country? Are these ticks that can cause this problem?
So generally, the Lone Star tick is one. The other one is the black-legged tick and the Western black-legged tick, and the black-legged tick, also known as the deer tick. So the general geography is the southeast of the United States, but going as far up as New York, even Canada. But like, that's the general geography that has the highest kind of prevalence. And then there is some on the west coast because of the Western black-legged tick, and then some in the north because of the deer tick territory goes up there as well. And now with climate change, the spread of ticks is going up. With the spread of ticks going up, and people being outdoors post-pandemic a lot more, there's a lot more people affected by it. In the military, there was a study that said 6% of new recruits are sensitized to it.
Oh, is that right? Huh.
Yeah.
Well, when we were living in Minnesota, ticks were very common. Like, they were extremely common. In fact, there was a nature preserve right near our house where I would like to take my dogs, but I avoided going in there, in May and June, because there were just so many ticks. I remember one time I came out of there and the dog had like 10 ticks. It was crazy. So now, some of these medications that you mentioned in your article, these are common everyday medications, like even heparin. You mentioned during coronary bypass and graft, they have to use heparin. Um, and, that's just an everyday drug. We use it all the time. You mentioned one of the statin medications, Advil. So there's a ton of these meds that have this issue. And so tell us about, pill
Yeah.
clarity and how that comes in.
Yeah. So thank you for kind of getting deeper into the topic and understanding the different pharmaceutical ingredients, but also how these kind of drugs are available in the market. So since you mentioned statins, let's take statins as an example. There is 40 plus suppliers of statins in the United States. While every statin, in this case, let's say atorvas, has the same active molecule, the inactive molecules could be different and the inactive fillers could be different. And for that reason, some people may react to one but not the other. So they need to know the exact supplier, the exact NDC, which is the National Drug Code, which is the identifying number for that particular tablet. They need to know that exact medication so that the patient does not have any reactions to it. So you would think that this is pretty easy to get,
Mm-hmm.
but unfortunately it is not. Lee, as we were saying, this topic, people need to know what's in their medications, and there are two kind of main buckets that one would think of, which is the drug manufacturer and the government, and how well or how good of a job are they doing in providing the patients the information that they need. So there was a paper in the British Medical Journal where they reached out to 10 companies and they only got an adequate response on animal-derived ingredients about 50% of the time. There was another paper that we did that's published, which looked at 20 companies. And again, 40% of the time, they were unable to give us an adequate answer. But most recently, we reached out to about 100 brand and generic manufacturers for the top 200 drugs. And we found that 50% of the time, we were not able to get the answer that would be suitable for a patient to know mammal-derived ingredients in their own medications. So while some of them are trying and doing a good job from a drug manufacturer standpoint, there's a lot of work that needs to be done. On the flip side, you're looking about the Daily Med, which is a government-based database of all medications. There's an independent paper that said 39% of the time they found discrepancies between what is listed in the Daily Med database versus what is actually in the drug. So
Wow.
that is a problem when people can have an anaphylactic reaction based on the medication that they consume. And you may appreciate this as a provider. If you have a patient with an average of 8 drugs, you're not going to call every manufacturer one at a time to try and figure out, which medication works. So to help these people was the genesis behind Pill Clarity. So we're right now helping 120,000 people annually, about 1,000 people on a monthly basis call us on some medication, and we can tell them exactly which drug at the level of the NDC they can take safely. So we're doing this. It's a free service that we're providing, and we're honored and happy to be of service for this patient population.
So do you
So
actually test the medication to confirm what they say?
great question. To our knowledge, a test does not exist for multiple reasons. One is there are limitations to testing where it cannot pick up the molecule at that low of a concentration, but people are
Oh,
still having a reaction. So it's like, you can test to some degree, but not perfectly. We're also finding that there is a discrepancy between what may be in the label and the reactions that patients may be having. So sometimes the product may say that it has a very small amount of gelatin in it, like in a vaccine, but clinically, majority of the patients are doing fine. So there is the theoretical concentration in a medication problem that we can try and figure out by testing, but that is also not a perfect solution. There's also what actually happens to a patient. And one piece of evidence around this is there's a small subset of people that have a fume reaction to alpha gal. This is very interesting. So I have seen this myself where we were going to dinner with a couple of friends who some had alpha gal, and we were walking next to a Carl's Jr. or it doesn't matter which company, and they literally had a reaction within 5 minutes of inhaling those fumes, right?
really?
So
Wow.
that is also very real, not for everybody, but for a small subset of people. We're just coming off of 4th of July. For them, going to a barbecue is not that simple. They need to think about
Wow, that
everything.
that is amazing. I've heard of that sort of thing happening with peanut allergies. just catching the fumes of a peanut for some people can cause a problem. So
Right.
let's say that somebody's having an anaphylactic reactions and there's a suspicion of alpha gal. How do the medical professionals, how do they confirm the suspicion that it's an alpha gal reaction?
So there is a alpha gal specific lab test that can be ordered. The general cutoff is zero 0.1, and you want to be lower than that. But yeah, no, there is a lab test, but sometimes you can be positive on a lab test but not have symptoms. And sometimes you can be negative on a lab test and still have symptoms. So the
Hmm.
lab test needs to be married with clinical symptoms for a thorough diagnosis.
And it's an IgE antibody that you're measuring. Is that correct?
Correct. Correct.
Yeah. Now, the other thing I found really interesting in your article was you mentioned that there's concern that just having this syndrome uh, predisposes to accelerated heart disease.
So, yeah, um, that pause is very accurately because there's a couple of papers that are showing that it may be changing the atherosclerosis pathway, and the atheroma burden may be different in these patients who have, alpha-gal syndrome. I do want to put a disclaimer out there that this is pretty early on, and we are just understanding the correlation between the two. That more policy work needs to be done on awareness on alpha-gal syndrome, making sure that people at restaurants and in packaging have alpha-gal labeling going on, making sure that the medications that they're consuming, they understand which ingredients they can and cannot have, making sure that healthcare systems have systems in place to dispense the right drugs, making sure that in the ER setting people are aware when people have alpha-gal syndrome of what to give and what not to give, making sure that when there's a procedure going on, when there's an injectable given, that the risk of a reaction is higher. We are looking at the risk benefit ratio and pre-medicating with the right medications, antihistamines or corticosteroids to kind of manage that patient is happening first before we create a public panic around increased risk of atherosclerotic disease. But since you brought
Mhm.
it up, absolutely, I think that our cardiology friends need to start looking at it to see, hey, are we seeing differences in patients who are having, alpha-gal syndrome or just sensitization? They may not have the syndrome itself, but based on the lab test, they have the sensitization. Is their disease burden different over time?
Mhm. Yeah, I could see that being a big problem. If I understand your article correctly, not only does it probably increase plaque formation, but unstable plaque, which of course is the stuff that triggers heart attacks. But I could imagine that even if it is a relatively small increase in the rate of accelerating coronary artery disease, given that it's so common, you could see that that would translate into a lot more people having symptomatic coronary artery disease.
Yeah, spot on. And there are many so-called brothers and sister comorbidities that happen with alpha-gal syndrome as well. MCAS is one of them. But yeah, you're spot on that there could be other things that could have minute changes that could have large consequences in the future. Now, for example, we know this from the blood pressure data, where a 1 millimeter of mercury increase in systolic blood pressure can have up to a 10% increased risk of stroke, which is what you're alluding to in your
Mm-hmm.
comment. So I think spot on, an unexplored area of interest that needs to be looked into.
Is there anything that people can do to protect themselves from getting this syndrome?
Um, Absolutely. Lots of DEET, permethrin coated clothing. There are many other things like that they can do that are on the so-called precautionary side of things. And there's an amazing website called Alpha Gal Information that patients can use that has a lot of this information pointed out for them. Sometimes it's as simple as, double-sided tape. I have so many patients having just success on top of medicated clothing that they're wearing, just putting double-sided tape on their boots when they're hiking out there, and the ticks tend to kind of stick to that, and,
Oh,
and that really helps.
oh, that's an interesting idea.
Yeah,
Um,
and
uh, Go ahead.
the other interesting thing is It is not just the fully mature ticks that are of concern. Even the baby ticks, the nymphs, are of concern in alpha-gal syndrome. And sometimes you can be hit with a tick bomb. That's like a cluster where it's thousands, and that's why those double-sided tapes can be very useful because they can capture a higher amount.
Yeah, no, that's a good idea. Um, you were saying that this can be a problem, like if somebody gets like a porcine heart valve, which of course is from pigs,
Yes.
that this could be a huge problem. And it's not like it's easy to take one of those valves out.
Right. It's not easy to put it in either, but
Right,
it's not
right,
easy
right,
easy to,
right.
to take it out. And yeah, it makes sense, right? Your body is now identifying this as a foreign substance that it doesn't want in there, so it's attacking it. So the rate of degeneration increases, or you could have a serious reaction to it. So of course, there's alternatives to that, non-porcine valves. So just having that little bit of awareness up front can completely change the outcome.
Mhm. And you mentioned that there's a relationship to blood type as well. How does that work?
So certain blood types are more protected compared to others. So depending on which blood type you are, you want to share that in the hospital setting.
Actually, I've got your article up on my phone here. Blood transfusion practices may also need adjustment due to molecular mimicry between the B blood group antigen and alpha gal. Individuals with blood type A or O may be more prone to cross reactivity.
Yeah.
Avoidance of type B red blood cell products in these patients could reduce the risk of transfusion related reactions. Well, that's interesting.
Yeah. So
Oh,
type
and
one.
there was, I think you even mentioned that some of these plant based
Yes.
compounds and pills
I
can
was, I was
cross
going to bring
react.
I was going to bring that up. So, Lee, since you asked a question about anything else, I think we should point out carrageenan, which is a substance that is made from red seaweed. Some people are reacting to that as well because it mimics the alpha gal molecule. And a good example of a drug with that is Pradaxa dabigatran. It does contain carrageenan in it, and some other formulations of Pradaxa do not. So a patient doesn't necessarily need to change the drug that they are on. We just need to give them another manufacturer. But carrageenan is a very important one to point out. Now, a small percent of drugs have it, but for those that are reacting to it, that small percent may matter.
Now, carrageenan is also in food products, so too, isn't it?
It is, yes. It's used as a binder, just like agar, or gelatin, of course, which is from an animal source. Agar is not. Carrageenan is not animal sourced, but for those food products that are made with carrageenan, patients would be reacting to it.
Yeah, it sounds like this could really evolve into being just an incredibly huge problem as more and more people are affected. So, Sachin, what other audiences does Pill Clarity deal with besides the alpha gal issue?
Yeah, thank you for asking that. So, of course, there is 33 million people in the United States who have some type of a food allergy, particularly the top 9 food allergens. So, some medications can contain, peanuts or shellfish that patients want to avoid. Lactose, if they're allergic to milk and milk derivatives. So we can tell them which medications do not contain lactose or peanuts, etc. For some of these food additives like peanuts, is a very small percent, but lactose, as you can imagine, can be a big one. Of course, gelatin, magnesium stearate can come from a plant or an animal, so it's 50-50. But that's one audience. The people with food allergies is one that we are happy to help. The other group is vegans and vegetarians. So this is not an allergy, but they have a preference for medications and food that do not have any animal-derived ingredients in them. So 6% of the U.S. Subscribes to veganism or vegetarianism, so we can find them medications that are suitable for them. And of course, there's people who kind of prefer kosher-friendly or halal-friendly or medications that do not have ingredients that subscribe with their religious preferences, and we help them out as well. So there's a good dynamic of people that we are helping, and again, this is through our free medical information center, pillclarity.org.
Yeah, it sounds like it's a phenomenal resource. Since you mentioned plant-based, now you've been plant-based for a long time. How long have you been plant-based?
All my life.
Is that right? Wow. Yeah. And you're not dissolving away from a protein deficiency, I notice.
Yes. Fortunately, I'm not. I'm still playing tennis and still doing things. So I think that the protein hypothesis has been debunked, but we're again not fully. There's still a lot of people subscribing to that. But the largest mammal, as you very well know, Lee, on planet Earth, the elephant is plant based. So
Right.
just at that level, something to think about.
Yeah, I think the whole protein conversations were quite interesting, and I think sort of the general internet dialogue is that we need more and more protein than we do, and yet the evidence supports that we're probably better off to actually cut down, which
Yeah.
people have a hard time wrapping their head around it. I just recently listened to an interview with Walter Longo, who's a longevity specialist. Um, I believe in San Diego. He's the guy that does sort of the laboratory research in this area, and he was really quite um, clear that pushing excessive protein, particularly animal protein, is probably shortening people's lives. And he actually thought that even if you're trying to build muscle, that 0.8 grams per kilogram of like desired body weight is sufficient. And most people are, of course, getting close to twice that. Okay. Well, when we were at Plant Strong, another thing that you raised at one of the meals was the issue regarding energy drinks. What are the problems with energy drinks?
So, as you mentioned in my introduction, I've been a faculty at University of the Pacific for a while, for about 17 years, and I've been blessed with doing research on all sorts of topics, from continuous glucose monitors to plant-based meal kits to avocados to continuous glucose monitors and energy drinks. So, on the topic of energy drinks, as you know, it's a multi-billion-dollar industry, and there were reports over, a decade to 2 decades ago where patients were dying from cardiac arrests. And these were reports that were in the news media. So I asked that this is a public health concern that needs to be investigated.
Mm-hmm.
So we've spent the last 15 years trying to figure out what is going on with energy drinks and heart health. So we've done a good close to a dozen studies, but there's two that particularly need to be pointed out. And both of them happen to be published in the Journal of the American Heart Association. Now, as a physician, Lee, you are aware that QT prolongation is a serious risk for medications that are being brought to the market. The FDA requires that all drugs be evaluated for QT prolongation because it predisposes you for an increased risk of sudden cardiac arrest.
Mm-hmm.
So we were thinking, because of some arrhythmic events pointed out with these cases in the media, we said maybe there's an arrhythmic risk that is going on. So of course it makes sense to do a study where we are giving healthy volunteers an energy drink and looking at their EKG to evaluate arrhythmia risk. The other thing we also noticed is that these people were drinking a decent amount of an energy drink that was, giving them, arrhythmias or potentially, a fatal outcome. So the initial studies, we kind of did 2 cans of a 16-ounce energy drink, so 32 ounces of an energy drink, and we did it. One that I want to point out is a study where we get 32 ounces of an energy drink versus caffeine, which is a very interesting question because now you're saying, is it all the other stuff that's in it, or is it just the caffeine? So we did a head-to-head randomized double-blind placebo-controlled trial. And what we found was that about the 2-hour mark after drinking the energy drink, when compared to the caffeine, there was about a 10 millisecond increase in the QT interval. Okay, now let's park that data for a minute and let's talk about the other study in the Journal of the American Heart Association. And we said, what about other brands? So then we did another study with two big brands compared to a placebo in this case, because we did not have a placebo in the first arm, we had a caffeine control. And again, same outcome. At about the 2-hour mark, we saw a 6 millisecond increase in the QT interval. So between these two studies in healthy volunteers compared to a placebo or a caffeine, we're seeing the same outcome, that is about a 6 to 10 millisecond prolongation of the QT interval. Well, that is about the degree of prolongation that the FDA would say, hey, you need to deep dive into this or put a warning in your drug product. So you take a drug like ranolazine, Ranexa, for chest pain, it has a warning in the package insert for about a 6 millisecond increase in the QT interval. So then that begs the question, should we be educating the public? Should we be having warning labels on energy drinks, specifically around the increased risk of arrhythmias? Now, it's not happening to everyone, but it predisposes people to, a sudden cardiac arrest or a fatal event.
Now, what is the active ingredient that's causing that change? Like, what is in the energy drinks that doing that?
Well, that's the million, or I should say $1 billion question. We believe that it's not the caffeine, because people have been drinking coffee for millennia, and we know that there's some data that caffeine is also protective from a mortality standpoint when you get to about 2-3 cups of coffee a day. And I just talked about the head-to-head trial comparing coffee or caffeine to an energy drink. And there's another study that was published a long time ago that showed that 400 milligrams of caffeine on its own is not a problem. And even the FDA guidance is around that 400 milligrams of caffeine per day is okay. So to your question, it could be the other ingredients that are in these energy drinks, such as taurine, glucuronolactone, Panax ginseng, and how all of these interact with each other. And it's possible, and probably very likely, that each one on their own might be okay. But when they interact with each other, there's an interaction that is happening that is predisposing someone to abnormal events, particularly from an arrhythmia standpoint.
That's very interesting. So just
And
to put in perspective, 400 milligrams of caffeine, would that be about 5 cups of coffee a day? Is that?
yes, so if you go with an 80 milligram dose for a small cup of coffee, that would be about five cups a day.
Yeah, that's
And if you
a
take,
fair bit. That'd be a fair
yeah,
bit.
yeah.
Well, that's very interesting. I've never had an energy drink myself, so I don't quite know what the attraction is. But
You
now
are you're one of the few people that haven't, Lee.
oh, is that right?
Yeah, the general use of energy drinks is very high. At least 1 in 2 people have tried it,
Oh, is that right? Yeah, no,
especially
I
in the
never
younger
have. I mean,
populations.
I find I get enough of a lift from a cup of coffee, so I've never bothered. Now, we were chatting the other day, and you mentioned something really interesting about avocados, because avocados are kind of interesting in the plant-based world, because some people say, oh, you've got to avoid them because they have too much fat. Other people say, no, they're actually good. The monounsaturated fats are beneficial. What is your position on avocados?
So first off, I love avocados, but there's no conflict of interest there. I do not grow avocados or sell avocados. I'm just a researcher. And we did this as a student project, believe it or not. And we just wanted to know, where everybody says eat more avocados, and what's the data behind it. So we did a meta-analysis, which is basically taking studies out there, putting them together in a scientific manner, and looking at what is the totality of data saying. So we did a meta-analysis of about 10 avocado studies, which showed that when you eat avocados, it decreases your LDL, your bad cholesterol, by about 16 milligrams per deciliter. Okay, it helps with total
Wow, that's a
cholesterol and
lot.
triglycerides
That's a
as
lot.
well. Yeah,
That's
16 is a great number, and it's kind of fascinating that it showed that degree of benefit, because if you take a drug like ezetimibe, that is known for monotherapy on its own can cause about 17% reduction in LDL. Now this is milligrams per deciliter, but it's still a pretty good reduction in LDL. Now, what was interesting from that paper that we did, which was a meta-analysis, is a public health message. Um, a sub-theme of that meta-analysis was, I don't think that we should be going around and telling everybody, just eat more avocados. Because what people are going to do is they're going to take their nice juicy burger, which has some nice cheese on it, and then they're going to put avocados on top of it. And now you're just increasing your caloric intake, your total fat intake. I think the thing to do is to replace the cheese with avocado fat instead, which is the healthier fat. And then you still get the creaminess or a cheese type feel. And yes, some people will argue there's no substitute to cheese. You could convince me to be in that camp. But from a health benefit, if you substitute the avocado to the cheese, I think is the $1 million recipe.
Hmm. Hmm. Yeah, I mean, avocados are, pretty high calorie. Um, Now, is that that drop in LDL cholesterol? Was that eating like one avocado a day, or what was the amount that they were
Yeah,
eating?
it's about a half to one avocado a day. That's a very good translation. And I know
Yeah.
plenty of people who are committed to eating an avocado a day, and they're in great shape. Because and also you're also eating calories, right? So you might be compromising by not eating other things.
Right. Right. Yeah. Yeah. Um, you have had some interesting comments about cinnamon and aloe vera. What should we know about those two compounds?
So we did some studies around using cinnamon for hemoglobin A1C reduction, and we also did a meta-analysis looking at aloe vera for hemoglobin A1C reduction. Now, the product that we had used is a particular one called Sinulin PF, which is a water extract of cinnamon. But essentially, both of those seem to have a reduction in hemoglobin A1C. And again, this is from the totality of the data. It is not acute use. You got to use it chronically. But
Hmm.
I would say the hemoglobin A1C reduction with aloe vera was about 1%. That is very significant, equal to some drugs, right? Not the newer drugs, but the oral, the gliburides and the metformins were coming close to that 1%, 1.3%. So a 1% reduction is very good. Cinnamon
So when you just before you go on, when you say 1%, do you mean like if somebody had a hemoglobin A1C of 8, it would go down to 7?
to 7.
Right.
That
Not
is
so not like 1% of 8, but like a whole percent. That's
a
huge.
a whole percent, yes. So that's
Yeah.
what the meta-analysis was showing. Now, I will say that we need more data. And I was recently at a healthcare conference where I found, and I have no ties to this company, I don't even remember the company, but that created a beverage, a functional food that combined cinnamon and aloe vera as well. And I believe the product was called Avon-C. So I'm not promoting
Hmm.
them, but I'm just saying that
Yeah.
there are people now that are putting products in the market, combining those concepts together. So I think that the food as medicine um, world needs a deeper dive, a better understanding, and there are many foods that you can take, but if you do it systematically with intention, can have phenomenal health benefits. And just as a plug-in, I feel the same way about the new GLP-1 drugs that are obviously indicated both for diabetes and obesity. um, we are very quick to give it to people with a BMI. Sometimes that's of 26, and their indication is not that. Their indication is 27 with comorbidities or higher, or greater than 30. But I've seen patients myself, BMI 26, they want to be on that drug. And some of the studies on these medications, they only had 15% of people that were in the BMI 27 to 30. So we don't even have fully understood that data. So my plug-in here is not anti using the drugs for the right people. My plug is doing diet and food as medicine first, and that could incorporate what you brought up, cinnamon, aloe vera, and any other things.
Yeah, that's really interesting because uh, my BMI is 28. Um, so 26, 27, it's like that seems kind of a bit crazy to be taking a medication. I mean, my personal view is, um, I think probably like you, is we should exhaust all the natural strategies to deal with diabetes whenever possible and or weight gain. Um, if you look at like the Advantage 2 study, the only demographic in that study that actually had a normal BMI were the vegans. And they surveyed a number of different dietary patterns, and the less animal products consumed, the leaner people tended to be. Um, I think like a well-structured plant-based diet. I can't prove this, but my suspicion is that most people that are overweight would probably get very close to an ideal weight if they just adhere to that. But of course, behavioral change is that, I think that's the $1,000,000 question, right? As far as trying to get people to live their lives in a way that they'll actually be healthy. Um,
Yeah,
now,
you bring up a very important point about implementation science, which is how do we do the behavioral changes that are needed? And I can probably go on that topic as well.
well, I'd be interested in your thoughts. I mean, I think one of the issues when it comes to encouraging people to eat a healthy diet, which is what, of course, we're all about that at Crisco and Company, is that it's not endorsed by your mainstream medical professional. Like if you speak to the average family doctor, they don't know anything about this, like nothing. Their knowledge is like the opposite of knowledge. I There's a few doctors I know, and they'll advocate things like the carnivore diet or low carb keto diets, and I believe those are completely the wrong way to go. Now, and we'll be meeting somebody casually, and we'll mention they'll bring up some health issue or whatever, and we'll mention, well, there is evidence that that particular health issue can be improved or even completely resolved with a plant-based diet. And the response is often like kind of a deer in the headlights. They're just completely incredulous. You can just sense their incredulity. And I really think that a big part of the problem is the medical profession, for all intents and purposes, is just um, mute about it. They never say anything about it. In fact, when I was working in Minneapolis at a very large downtown, highly respected hospital, there was a McDonald's in the hospital. And it was literally paces away from the heart hospital. Now, there was a new CEO and they got rid of them, which I agree with that decision. But because, the whole thing about diet and particularly whole food plant-based is not endorsed by mainstream physicians, uh, we lack credibility, and it's hard to get traction on it. I mean, and at times it really frustrates me because I basically spend my day looking inside of people's bodies with CAT scans. And firstly, everybody, say my age, has evidence of dietary damage with atherosclerosis or, changes in their liver or, gallbladder disease, et cetera, et cetera, et cetera. The list goes on. And I just personally sort of see it as a kind of a fool's errand that the answer is always another pill. I don't know. What are your thoughts?
um, I hope you cut this piece of my interview out, but if you don't, that's acceptable too. But I'm going to tell you what happened yesterday. And I was having a conversation with a cardiologist friend of mine who told me a story about a patient who was asking about what they can and cannot eat after they had an invasive procedure done, specifically put in some stents. And the interventional cardiologist said, eat whatever you want. I just gave you a new heart.
Oh,
So and I'm not saying everybody is doing that, but I think that I am embracing what you are saying, that do we as providers, as healthcare professionals, need to change our mindset a little bit more. And we know that food is medicine. We know that there's data around plant-based, primary plant-based diets being more beneficial for patients. Why do we not have more succinct, robust, well laid out guidelines around it? Because it is not easy. So I do think
mm-hmm.
that what we need to change is us as providers and our messaging, and need to have stronger guidelines on what is right. And that's why I commend you for what you're doing, because your podcast and everything that you're doing is putting that message out. So unfortunately, my outlook is more that we can do more as providers to better help patients. Now, there are
Mm-hmm.
other things on an implementation science that can be done as well from a policy front. And I think that we did a study, if I may take a minute, and this was in the military setting. We presented it at the American Heart Association as an abstract, where we took carnivores and we gave them 1 month of free food. And this was a randomized clinical trial. So imagine now you're taking somebody who's used to eating about 5 servings of red meat per week, and you're randomizing them into eating a plant-based diet or continuing a standard American diet, which is not necessarily plant-based, right? And we gave them free food for a month. And what happens? And you're looking at people with a BMI above 25, that was the criteria, but their LDL at baseline was relatively good, was about 105, okay? And just in 4 weeks, about 27 people in each arm, so over 50 people together, randomized again, there was a 10% drop in their LDL after 4 weeks. That is incredible.
Mhm.
There was a
Mhm.
reduction in weight as well, but the LDL drop is very meaningful. So I think that people often want to eat healthier. They don't know how to eat healthier. And if we can give them the tools, I think many people will embrace that healthier diet.
Mhm, mhm. And of course, after you've been doing it for a while, it's there's no hardship at all. Um, Joyce made this spaghetti dish from Will Bolsewitz's book the other or yesterday, and it was so tasty. We're going to have it again tonight. And there was no animal products in it at all. And our experience is we have more variety in our diet now that we're plant based than we had before we went plant based. So you don't get bored, and it's not a hardship because your tastes change. Um, as part of my breakfast this morning, and I'm doing this fairly regularly right now, is we've got a garden, fresh kale out of the garden, steamed, a little bit of balsamic on it, and I think it's just absolutely delicious. But that perception, that taste, admittedly, it does take some time for your taste to change. Excuse me. But once they change, I think overall the net enjoyment of food is better than when I was eating a more standard diet,
You are
which
you
was
are so
meat,
spot on.
chicken.
Yeah, you are
Yeah.
so spot on. Like, take the simple ingredient nutritional yeast that I know you very well know. The moment you start putting that in your pantry, a lot changes.
Hmm.
There's a Persian herb, zatar. It's got like some herbs and sesame seeds and whatnot. And so I put that on my avocado toast now in the mornings. And
Mm.
again, you can put nutritional yeast sometimes, zatar sometimes, just salt and pepper a third time, balsamic another time, and you could have a different flavor every single day. But I think that I wanted to really highlight your point around, you can have more options eating plant based. It's actually not as difficult as one may think.
Yeah, you mentioned the nutritional yeast. Actually, we the spaghetti dish we had yesterday, we make this sort of faux parmesan with nutritional yeast, and then garlic powder and onion powder, and it's really good. It's really good, and you don't have to worry about your arteries plugging up.
So
The nutraceutical. Go ahead.
so let me tell you how I make my own life even harder. I actually don't eat onions and garlic because of the faith that I believe in. Okay, and that
Oh,
yeah.
really?
So now imagine eating a diet where you're not only plant based, but you're not eating onions and garlic, which seems to be a staple in everything. But even with that so-called criteria, I have plenty of options. And then you ask,
Oh,
what
yeah.
is an alternative to garlic? Truffle oil. Actually, if you can start putting some truffle oil, it can replace out the garlic feel. What is an alternate to onions? Celery. So there are many hacks. There are many food hacks out
Mhm.
there.
Oh yeah, for sure. Yeah, I mean, and if there's some food, whatever that you truly can't accommodate to, you don't like it, you don't have to eat it. Like if you don't like tofu, you don't have to eat it.
Yeah.
So there's plenty of options. Just circling back on the nutraceutical thing, um, my concern with nutraceuticals, sort of broadly speaking, is to look to the nutraceuticals first rather than the basic diet. And a number of years ago, I actually did the certification in um, anti-aging and regenerative medicine through the American Academy of Anti-Aging. And I was really quite interesting. But then when I started to learn about plant-based nutrition, I really felt that they were kind of missing the boat because there was so much emphasis on supplements rather than just eating the right food. And my fear is people will spend all this money buying these nutraceuticals, and it creates sort of a moral hazard where they're not actually eating good food as the basis of what they're consuming.
Yeah.
I don't know. What are your thoughts?
My thought is I am the example. And even if it's an N of one, it's an N of one, which is I've been plant based all my life and I don't take any supplements. Now, there's a lot of people, if you eat a well balanced diet, supplementation is not really necessary. In fact, some of the science will say that as well. And some people will go to the extent of saying supplementation is just very expensive pee, right?
Mhm.
So yeah, the science doesn't necessarily support taking multivitamins as a public health measure where everybody is taking it. That being said, certain deficiencies that are isolated, supplementing with that nutritional deficiency has value, right? So there's not a question about that necessarily. But, spray and pray method of taking every supplement as a safety measure, there's no data to support that. So I'm kind of in that bucket. But the more important emphasis is a well balanced diet, multiple colors on your plate, variety. I don't think supplementation is necessary.
Now, do you take a vitamin B12 supplement?
So I actually don't, but I am familiar with many vegans and vegetarians who are deficient on vitamin B12 as well. And in those cases, that's perfectly okay. If you, nutritional yeast has a lot of vitamin B12 as well, as you know. But I actually, even before I was kind of eating a decent amount of nutritional yeast, I've never had a vitamin B12 problem. So I don't.
Oh, is that right? Yeah, yeah. Well, there's three supplements that we take, and the rationale is we take the vitamin B12 uh, just to be sure, a couple times a week. Now, we do drink fortified soy milk. We have nutritional yeast, but taking the supplement, we're just assured that we get enough. Vitamin D. If I don't take vitamin D, I tend to run a little low on my levels. Like even during the summer, I've had it tested at the end of the summer after being out biking a lot through the summer. So I take a vitamin D, fairly conservative in it. Um, uh, and the third one is kelp, which is really a food, and I only take it 3 times a week. Very cautious about it because kelp can be too high in iodine. And actually, Michael Greger recently did a video about iodine in vegans, and it can run a little bit low. One of the main sources of iodine for most people is dairy products because they put iodine on the teats of the cow to milk the cow. Um, and so they get the iodine sort of secondhand that way. So we take just a little bit of kelp just to be sure that we're getting that. And those are the only ones that I take. Now, when I was into the whole anti-aging thing a number of years ago, I think I was taking like about 40 supplements. It was crazy. And then I sort of realized this has got to stop. I mean, it was just too much. And you don't really know how these things are interacting. Uh, and I think a lot of these things don't really have long-term data to support that they're necessarily good for you. I mean, it turns out that some of these things you have a reason to believe that they're not good for you. Like I remember I was taking carnitine for a while. Well, carnitine can be a substrate for trimethylamine oxide, which is atherogenic and promotes renal failure.
That's right. Yeah.
Um,
Yeah.
and uh,
Yeah. And on that note, I saw this very interesting paper on the atherosclerotic risks around TMAO, but also how
mhm.
it can be reversed by fasting. Okay. And it kind of marries
Oh,
your
really?
beautiful point about anti aging, TMAO, and now fasting, where they showed that the gut microbiome, which is responsible for the TMAO as well, kind of gets washed away after you do a 24-hour water only fast. So now,
Hmm.
and it takes about 2 weeks for that gut microbiome to kind of come back. So imagine doing a water only fast every 2 weeks. That could be beneficial as well. But to your point, there's not enough data around it. We're just understanding the fasting world. But I do believe that there's a correlation between fasting and long-term benefits, one of them being anti-aging.
Yeah, I mean, I think it's a fascinating topic. I mean, the longest I've ever managed to go intentionally without food is about 24 hours. But I do, at some point, I want to try maybe like a 4 or 5 day fast. I heard Dr. Alan Goldhammer, whom I'm sure you're familiar with, um, just sort of in passing in an interview, I mentioned a couple of things I thought was really interesting, like lipoprotein A. I assume you are familiar with lipoprotein
Yes.
A. It's a risk factor for coronary disease that about 1 in 7 people have. I'm one of them. But interestingly, there's not a whole lot of heart disease in my family. Now, my grandfather died at age 69, which is 3 years older than I am, but he smoked a lot and he had central obesity. But it's a genetic thing. So it does concern me a little bit, but being on the plant-based diet, hopefully that's offsetting that. But he sort of in passing mentioned that people can get lasting significant drops in their lipoprotein A with a medically supervised water fast. And then the other thing that he kind of mentioned in passing is benign prostate hypertrophy, which almost every male gets as they get older, making it more difficult to urinate. And there was a guy at that Plant Strong retreat. I don't think you were at that meeting, but he had actually had prostate cancer, opted to not have the surgery that they recommended, and went to True North, fasted for 10 days. And he's like a pretty buff, fit dude. Like 10 days, I could see that would be troublesome. And it's not like he had a lot of weight to lose. Did fasted for 10 days, dropped his PSA. And of course, before and after he's on a plant-based diet, dropped his PSA, obviated the need for surgery, and also mentioned that sort of less problem with the prostate symptoms with the urine flow after his water fast. So I thought that was all fasting. There's probably tons of conditions that haven't even really been explored yet that will benefit from supervised water fasting.
Could not agree more. And I think that fasting should be an FDA approved so-called intervention or drug, for lack of a better word. In some arenas, it is that powerful. It really is. And there are some communities who have been doing this for centuries. We talk about 5 days. There are some communities that can go for multiple weeks without food, and they'll take water. And for them, it's not that difficult. So we know that the human mind and the human being is very powerful, and we can push our limits beyond what science can appreciate. And there's also additional benefits of fasting, which is it makes also your mind and your willpower stronger. And I know I'm going into a different topic here, but Angela Duckworth said the most important thing for success is grit. It wasn't your IQ, it wasn't other things, it was grit. And can you build more grit by developing your willpower? Can you develop your willpower by testing yourself on fasting and saying, okay, I'm gone a day, now I'm going to go 3 days, So I think there's some interesting stuff there that is, a panacea for human health as well.
Oh yeah, I think you're probably exactly right. It's interesting the comment about the grit. Like I work out almost every day. I do some kind of exercise. Typically 4 days a week, I'll do a weight training program. I do a lot of biking, both indoor and outdoor. And I got to admit, there's some days I don't really want to do it, but I do it anyway, knowing that once I get into it, I'm going to be enjoying it. But then if you say you're going to do something and you don't do it, I think it kind of chips away at your soul a little bit, like you've been defeated. I was out biking a couple days ago, and there's this route I did, and I want to get some hill work in. And I said, well, I'm going to go back and forth on this particular stretch 4 times, where there's some pretty big hills. And I got to the 3rd time, I said, maybe I should just go home. He said, no, you can't do that. You said you were going to do 4 times. You got to do it 4 times. Otherwise, it just, it's like you've been defeated. But anyways, I'm sort of getting off on a tangent there.
Let me ask you, how did you feel after you successfully did 4 versus less?
Good. Yeah. I mean, there was a sense of accomplishment, it was a good workout. So I think one of the problems, Joyce and I have had some conversations about this, that one of our problems in our modern society is that we're so into comfort that we don't exercise being uncomfortable. And then, of course, that gets into that whole thing with the dopamine reward systems. There was a really good book I read, 6 months ago called Dopamine Nation. I forget the author. Have you read that one by chance?
I haven't.
Oh, it's really interesting. It explains the whole basis of addiction and how people are chasing these dopamine highs. And it doesn't matter what the addiction is, whether it's shopping or cocaine, the biochemistry and the physiology is exactly the same. And that one of the things, like to be non-addictive, is that you have to regularly experience some discomfort.
Yeah.
to maintain this homeostasis of dopamine. But it's really, and just digressing to the fasting thing, Joyce did a water fast for 5 days, I don't know, about 4 months ago. And the first couple of days, she's really uncomfortable. And then you hit this threshold, apparently, where suddenly you develop a relative indifference to food. And then you're comfortable fasting.
And
Are
you're
you
more
familiar with
alert.
that?
I am very familiar with that. There's this kind of J-shaped phenomenon, right? Where initially you kind of feel worse, 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 and then all of a sudden you feel better. And people have told me that that alertness has gone up. Can you believe that? You're
Mm-hmm.
actually more alert with not eating. So yes, I've experienced that myself, but I've also heard it from several friends who have gone through this. So it is very interesting how that works. And
How long have you gone on a water fast? What's the longest that you've
so
gone?
I've done several types. I have done no food, no water for 24 hours.
Oh,
Okay.
really?
Yeah. But I have done one where I only had 4 bites of food for lunch and 4 bites for dinner. And I went for about, 2 weeks for that. I did another one where I ate 1 bite the first day, 2 bites the second day, 3 bites the third day, 4 bites the fourth day. So 1 to 15 and then 15 down to 1. Okay.
Oh,
And that was for a
wow.
full 30
Wow.
days. Yeah.
Holy
Yeah.
cow.
So
How did you feel after that?
I felt
How
good.
did you feel after
I
that?
felt good. And more than the food part of it, the fact that you did it, you feel invincible, right? Like just the mental high you
Yeah.
get. And that's why I was asking you about how did you feel after you did your 4 rounds of bicycling versus less, is because the high that you get despite the fatigue is worth a lot.
Hmm.
And that's why when you have a good
Hmm.
work day, right, where you worked maybe
Hmm.
14 hours, 16 hours, but you don't feel tired because it was a good work day where you're putting in a lot. But if your mind is not there, then in that case, even 4 hours and you feel tired after that, right? So there's an aspect
Yeah.
of mindset and how you feel as well.
Yeah, for sure. For sure.
And for me,
There was some,
the 30-day fasting, I was only able to do it because I pre-decided that I am going to do it. But if my
hmm
will was 50-50 up front, I don't think I would have been able to do it.
hmm hmm Yeah, you've got to make a true decision. Oh, well, it was interesting at Plant Strong, sort of a sideline conversation with Doug Lyle. He it was some amazing statistic that he had, like after either a 10 or 14-day fast. They've done studies where the amount of lean tissue loss was way less than you would think. It was like literally like 1 pound of muscle
Hmm.
lost after like a 10-day fast, which of course you could build that up pretty quickly. I mean, that's
Yeah.
kind of been one of my fears is, I work hard to build up my muscles working out. I'm afraid, it's just going to dissolve away when I go on a long fast. But apparently that's not true.
Well, yeah, I don't think so either. But that being said, I don't think you and I are sitting here promoting, long fasts for everybody as a mass
No.
intervention for the population. But I think it's a great kickstart. I think that's it's a good reboost kickstart. Good to kind of start at baseline again. And I think that in those
Mhm.
settings, any kind of muscle mass loss is going to be so negligible that it doesn't matter in the grand scheme of things. So we're not saying doing it every month.
Right. Yeah. And we probably should put some caveats in. If somebody's thinking of doing a longer term fast, um, they should probably check with their doctor. There are some people for whom fasting is actually contraindicated.
Sure.
Certainly if you have an eating disorder, or, brittle diabetics, or if you're pregnant, or whatever. So it shouldn't be undertaken casually. And apparently, True North, they do have telemedicine consultations where you could do a supervised fast remotely. So I would exercise some caution in that regard. But anyways, we've been talking for over an hour, and I want to be respectful of your time. Really appreciate it. Really appreciate it. Perhaps we can have you on again sometime
That'd be,
because
that'd be fun.
you got some great information.
Thank you. This was a lot of fun. Thanks for having me.